Hi everyone, my name is Allison Blazik and this is my presentation on Angelman syndrome. So to begin, we have a brief description and diagnosis of what Angelman syndrome is. Angelman syndrome is a rare genetic disease caused by a loss of function to the UBE3A gene on maternal chromosome 15. Some main characteristics include poor balance, a happy demeanor, and little to no speech. Next, I'm going to play this video of a man whose son has Angelman syndrome.
All right, so here we are. I'm going to talk a little about Angelman syndrome. Hi. So it's a rare genetic disorder. It's actually in the autism spectrum. But it's actually a mutation of chromosome 15. So there's a deletion in chromosome 15. And there's some characteristics. A lot of Angelman children are misdiagnosed all the time, but there's characteristics. So once you see an Angelman kid, you'll always know. So Harley, look at him. Smile. So they have spaced out teeth. A lot of times they might have a protruding tongue. They walk with an unsteady gait. And unlike a lot of autistic children where they don't like to be touched, Angelman kids are completely the opposite. They're always loving, wanting to give hugs and kisses and snuggle, so they always love that affection. Anyway, there you go. Bye-bye.
Moving on, we have the etiology of Angelman syndrome. So normally you would inherit a copy of this chromosome from both your mom and your dad, and this chromosome is responsible for providing instructions to make ubiquitin protein ligase E3A. When this chromosome is deleted, there is no way for any instructions to be made to make this protein. Next, we have the pathophysiology of Angelman syndrome. Some common symptoms include absent speech, ataxia, brachycephaly, which is a short and broad skull, hyperreflexia, which is increased reflexes, and maxilla hypoplasia, which is a small maxilla. In the video we watched, he said that Angelman syndrome is part of the autism spectrum, so they share a lot of common symptoms. One thing that I found really unique was how affectionate those with Angelman syndrome are and how different it is to other disorders on the autism spectrum. Some other symptoms would include spaced out teeth and a protruding tongue, like he stated in the video, and behavioral changes, and a lot of individuals with Angelman syndrome also have epilepsy. So next we have the prevalence. Like I said before, Angelman is very rare. There's only about 1 in 15,000 live births, which equates to 500,000 cases worldwide. Next, we have the related populations and disorders. So it affects males and females equally, and it shares symptoms and characteristics with autism, cerebral palsy, and Prader-Willi syndrome. In the video, he stated that Angelman syndrome is often misdiagnosed, and this is due to sharing these symptoms and characteristics of other disorders. Next, we have the risk factors and precautions. Because AS is so rare, risk factors are hard to know. But there are a few precautions that I feel are very important. One of those being a fall precaution. Due to the unbalanced gait and poor balance, falling is very common among these individuals. And then there is a seizure precaution. Because many of these individuals have epilepsy, seizures happen often. It's important to make sure that when an individual does have a seizure, that they do not cause any more injury to themselves. It's also important to continue to adapt and modify their environment as their symptoms progress. So now we have medical management and OT intervention. Some medical management could include anti-seizure medication or a low glycemic index treatment. LGIT, when used with anti-seizure medications, has reduced seizures more than 90%, according to a small study done in individuals with Angelman syndrome. The low glycemic index treatment is basically a keto diet, but not as strict. This diet has proven to be beneficial in reducing seizures. You could also do physical therapy, behavioral therapy, and then most likely occupational therapy. And some interventions for occupational therapy could include focusing on fine motor skills, visual skills, oral motor function, and sensory awareness. So now we're gonna move on to our game, and for our game, I've made an Angelman Jeopardy. So we have our two contestants, Elizabeth and Ajane, and they'll be playing Angelman Jeopardy. So who wants to go first? Someone just say something.
I'll go.
Okay, would you like diagnosis and brief description, prevalence, medical management, or pathophysiology?
Medical management.
All right, 100 or 200?
100.
All right. So what is one form of medical management? Write your answers down. All right. Elizabeth, give me your answer.
Anti-seizure medication.
All right, that is correct. Ajane?
Behavioral therapy.
That is correct. You both get 100 points. Ajane, your turn to pick a question.
Diagnosis and brief description.
For how much?
200.
All right. So that question is, what are two characteristics of Angelman syndrome? All right, do you guys have your answers?
Mm-hmm.
All right, Ajane, what's your answer?
Poor balance and tremors.
All right.
Happy demeanor and tremors.
All right. Played a few rounds and now we only have 4 left, so we're gonna continue. Who would like to choose next?
I'll go first.
Okay, what category would you like?
What were they again?
Diagnosis and brief description, prevalence, medical management, and pathophysiology.
I'll do pathophysiology.
All right. Your question is, what is brachycephaly? All right, answers?
Short and broad skull.
Correct?
Short and broad skull.
Correct. All right. So far we're tied with, apparently not tied. They're tied with 700 each. They've both gotten every answer correct. Moving on, what would we like?
Prevalence.
All right. What age is Angelman syndrome diagnosed typically? All right, answers?
6 to 12.
Correct?
6 to 12.
Correct. I really think it's just about to be a tie. Oh my God. All right. Next.
Medical management.
All right. Your question is, what is one way OT could treat Angelman syndrome? If it's not in there, it's in the back. That's okay. I'll give it to you guys anyways. All right, answer?
Habitual training.
Communication therapy.
Yes, I think I accept both of those. Oh, just kidding. Wrong. Sensory processing. What? That's not. Fun fact, that last question was not right. I don't know what happened there. We're just gonna ignore that one. All right, we are on our final question. So prevalence for 100 is the final category. And what gene deletion causes Angelman syndrome? Again, it's in the diagnosis and brief description area.
You just said prevalence.
I meant diagnosis and brief description. No cheating. All right, and that was my presentation on Angelman syndrome. I'd like to thank my 2 roommates for playing Jeopardy with me. Thanks.